Spoke to our next guest, a public health specialist from the University of Cape Town, Dr. Kerrin Begg. It was about epidemic fatigue, and today is no different. With 6,000 plus infections in just a 24-hour period, South Africa is in the second wave of the coronavirus. That was officially confirmed last night by the health minister. Now, there's much concern specifically about the youth at this stage, where infection numbers have increased, but also the festive season is upon us. How do we ensure that we stay safe? How do we ask others to respect our wishes? And how do we change our behavioral patterns? Dr. Kerrin Begg, good morning and welcome back to Morning Live.
Good morning. Thank you very much. Good morning. Yes, I think that it really is very concerning. We, I suppose, hoped that we might avoid a second wave, but the pattern is there for the rest of the world that second waves are come during pandemics historically, and also we've seen from other countries that second waves come. I think that part of the fatigue is obviously in the early days. We were a little ruled by fear. We didn't know what we were dealing with. We were and took the precautionary principle. I think now people are tired unless they know somebody close to them or they've been affected themselves. It's, you know, I'm tired. This has been a long, hard year, and I need to celebrate. And I think we really need to try to get across the impetus that actually my behavior affects other people, and other people's behavior affects me. So, you know, remember when we spoke about masks, that my mask protects you and your mask protects me, is that we talk about trying to be in bubbles, but actually we don't live in bubbles. And so what other people do does affect so many people around us. So that fatigue of living on adrenaline, of the fight or flight mode, is exhausting, and what we need to get to now is for people to be doing the non-pharmaceutical interventions and behavioural interventions in the same way as they put a seatbelt on when they get into the car, that it's just simply habit. That's what we do. So when we go out, a mask is on our face. We are automatically keeping physically distanced from other people. We're not touching. We're constantly sanitizing our hands, and it just needs to become part of our psyche, part of our habits.
And if we could talk about the weather for a moment, Dr. Begg, because we are entering our summer season right now, and it is getting very hot. Those masks are becoming, you know, sometimes unbearable to keep on. So let's talk about that. And is there something that can be done, you know, in the way in which we socialize differently because of the weather? What can be done there?
You're absolutely right. So the things that we need to think about, and I think that's where people are tired of rules. But when we understand how the disease spreads, and therefore why these guidelines were developed, is that then we can take appropriate action and behave in a way that prevents the transmission. Because that's really what we want to do, is that each person who gets COVID is not necessarily because they did anything wrong. That's the way pandemics work. But what we can do is make sure that if any of us gets COVID, that we make sure it stops with us, that it doesn't spread to anybody else, and that we don't have anybody else infected, or at best and at worst, that they end up in hospital with severe COVID or even passing away. So the kind of things that we need to think about is dose, dispersion, and distance, the 3 Ds. So in terms of dose, the way that we're able to reduce the viral load, so the amount of viral material that other people are exposed to, is by wearing a mask. The way that we're able to mitigate against distance, against people spreading there, is that because it's droplet spread and occasionally aerosolized, and that's why people talk about airborne. It's not really airborne, it is aerosolized. And so tinier particles than droplet spread can spread. And so the further away we are from people, the safer we are. And then dispersion is similarly that in areas, in enclosed environments, such as a small room with no airflow, is also part of the challenge. or in fact a closed room with a fan would be even worse. So that helps us to think about that the best type of opportunities, and particularly for us in summer, is go outdoors. Go and spend your time outdoors, because automatically you are reducing the dispersion factor. Do activities in small groups or on your own, and keep apart as far as you can from each other, and that sorts out distance. And then wear your mask. Find a mask that's comfortable, that you're comfortable to wear, and there's really no excuse. Children around the country have been wearing masks every single day for a full day. For most of us, we're privileged enough that we can spend part of our day alone and can take our mask off for a period of time. But in fact, children have been phenomenal in the classroom, have been able to keep their masks on for protracted periods of time. It just takes getting used to. Find a mask that's comfortable, that is over your nose and mouth, that is light enough that you can breathe through, but at the same time has 3 layers to make sure that droplets are not passing through it.
And speaking of children there, Dr. Begg, there is, of course, a lot of concern at the moment about the youth and the increase in the number of infections among 15 to 19-year-olds in particular, as the Health Minister highlighted last night. So let's talk about that for a moment, and going back to that previous discussion about COVID fatigue and what we're seeing among the youth right now.
So remember that youth and adolescence is a time of risk-taking anyway, and a time of pushing boundaries. So it's not unexpected. It obviously is disappointing that youth are taking risky behaviours, but it's certainly not surprising. So what we really need to be doing is finding influences. Unfortunately, the youth don't necessarily respond well to doctors and health professionals telling them what they shouldn't be doing. So we need to be finding exciting ways and providing opportunities for youth to be doing things that are safe. The kinds of things that we really want to prevent are these amplifying events or super spreader events, which are parties with large numbers of people in enclosed environments, in close contact, without masks on because they're drinking. And remember that alcohol automatically reduces your inhibitions and your ability to make good decisions and good choices. And so people then often remove masks and engage in close and intimate contact. So we're really wanting to try and avoid those kinds of events. So that's about avoiding the 3 C's. So I've spoken about the 3 D's, and the 3 D's are avoid close contact, avoid crowded spaces, and avoid closed places. So you're really wanting to, and you know, those super spreader events, rages and parties and clubs, in fact amplify, they exemplify those 3 C's. So we're really wanting to avoid those. So it's not unusual. I think it's not unexpected, let's say. I think it is just very disappointing that that's where our biggest increase is at the moment.
And because we have been dealing with the pandemic for the better part of the year, Dr. Begg, you often hear people say, well, you know, if I get it, I get it. How do you then deal with asking other people to wear their masks and to abide by the protocols? And also, because we're running out of time, let me just throw in another question about most people going home, as it were, over the festive period, and how that should be dealt with.
So I think that the going home is really tricky. People really wanting to see families. They've been away for a long time. They've been isolated. But once again, if they can follow the avoiding the 3 C's and thinking about the 3 D's. So avoid crowded places, closed spaces, and close contact. And obviously, in our public transport system, that's particularly difficult for a protracted period of time. So what you're really wanting to do is make sure that you sanitize, wear your mask all the time, because that's in your control. And then take frequent breaks, keep windows open if you're in vehicles, get the airflow through. So remember that wind is your friend. Fresh air is your friend at this time of year. You want the wind to be blowing, you want airflow to be traveling through to blow the virus away, and the droplets that are carrying the virus. So really try to do that. When people do get home, think about the fact that they may be carrying the virus. And that's one of our biggest challenges, is that with the incubation period, is that a lot of the transmission is happening before people have symptoms. So they may well be positive already, but they're asymptomatic, and so they don't know, and so they don't behave as if they have COVID. So we all need to be behaving as if we have COVID and are wanting to not spread it to other people. So we need to be protecting those around us and thinking of our friends, colleagues, families, and really thinking in a social solidarity space, that we don't want to spread it to others rather than I don't want to get it. That's really the kind of thinking that we need.
Well, we have to leave it there, but thank you so much once more, Dr. Kerrin Begg, who is a public health specialist at the University of Cape Town, talking to us about South Africa's second wave of the coronavirus and, of course, how to assist with epidemic fatigue, and also just generally how we could adapt our behavior to better deal with the second wave. And it, of course, also speaks to our question of the day, where we're asking you whether you feel better prepared this time around to deal with this pandemic or the second wave of it. At Morning Live SABC is where you can get in touch, and we'll share some of those views later on in the show.